To our talk about simultaneous 2 and 3 photon microscopy for improved medical diagnostics. My name is Oliver and I will share the talk together with Laura. The outline for today is first we will start talking about the fundamentals. We will talk about linear and nonlinear microscopy, and we will talk about 2 and 3 photon processes. Finally, I will talk about the advantages for very short pulse durations, and we will talk about how you can do simultaneous 2 and 3 photon excitation. And then I will hand over to Laura talking about multiphoton applications. So we're talking about optical microscopy. Optical microscopy can be used to achieve a very high resolution and high contrast imaging with minimal photo damage and maximum of penetration depth. Application examples we are also talking about is the visualization of tumor structures. You can use optical microscopy for cell-to-cell interactions, and you can also do some kind of long-term imaging and do in vivo detection of signaling pathways. If we talk about microscopy, there's a so-called linear or fluorescence microscopy, which is limited in the penetration depth, and it can cause also significant photobleaching and also phototoxicity. To overcome these limitations, you can make use of so-called nonlinear excitation. And now I will just show you how it works. If we compare a linear excitation and a nonlinear excitation, you need to keep in mind that, or let's say we can just think about energy levels. In the linear case, you just have a wavelength to excitate a molecule, and finally you will get some kind of fluorescence. If you want to do nonlinear excitation, you have to have two photons. Finally, you have to have the same energy to excitate the niveau. And that means if you want to have two photons, you have to have half of the energy, which means you have to have double the wavelengths. Finally, you get the same fluorescence as before. And if we talk about multiphoton microscopy, you need to have this multiphoton excitation, which means you have to have photons to be at exactly the same time at the same place to get the excitation. And this can be done if you just use a very short pulse, as you will see later. And what you also need to do is you need to focus the beam. And you can see on the right side that there's, from the left side is coming a beam. In the linear case, you just see the beam. From the right side, you just see that there's a very tiny small spot in the middle. This is exactly the focus. And this is why I mentioned photons have to be exactly at the same time and at the same space. You only get an interaction only in the focus because there's the peak power high enough that you can excitate a molecule. You can just now think about moving the focus in all directions, which in the end gives you some kind of 3D imaging opportunities. Another advantage for nonlinear microscopy is you have a very low heating of your probes because you're using a pulsed laser. And finally, this leads to a reduced photobleaching or photo damage. To get all the benefits, you have to use a femtosecond laser, and I will just now explain you why it's important. Before we talk about the laser, we talk about nonlinear processes. In general, there are different processes you can address. The first one is a so-called two-photon fluorescence. So you have to use two photons, and then you finally get a fluorescence with a slightly lower energy. You can use a second harmonic generation, which in the end you have to have two photons, and you get the same energy as one photon back. For three-photon fluorescence, you have to use three photons. In principle, it's the same as for the two-photon fluorescence. And for the third harmonic, it's a third harmonic process. So you take three photons and get one photon out of it. In the end, you can use second harmonic generation for optical non-sensible symmetry structures. And you can use third harmonic generation for optical heterology structures. Laura will give you some more details about what you can see finally. As I said, you have to use a femtosecond laser to do multiphoton excitation. You can just think about why a short pulse is necessary. You can just think about if you have a long pulse, the probability that two photons are exactly at the same time at the same space is quite low. So the shorter you make the pulse, the higher the probability. Which means, yeah, so the probability increases if you have a shorter pulse duration. And only if you have the photons at exactly the same time, at the same space, you get the multiphoton absorption. You can directly imagine that the probability goes down for a three-photon process. Just to see how this works and how it's beneficial to have a shorter pulse, it's illustrated on the left side, two different pulses, one having a pulse duration of 33 femtoseconds and the other one around 180 femtoseconds. The area of both pulses is more or less the same, which you can see on the peak power on the left side. And you can just directly see, if you just dense the photons into a shorter pulse, there's a higher probability that they arrive at the same time. Finally, the shorter pulses, if we compare a 200 femtosecond pulse to a 40 femtosecond pulse, just decreasing the pulse duration by a factor of 5, it just leads to a 5 times higher efficiency in the two-photon process. If we think about three-photon processes, the scales to the square, the probability increase by a factor of 25. If we now compare the two-photon efficiency and keeping this the same, it also means that you can reduce the average power of the laser by a factor of 5, which will in the end reduce the thermal heating of a probe by a factor of 5. Finally, you get a reduced photo damage, and you also get a higher contrast resolution in the scan does. To illustrate what happens, you can see here a calibration grid where we use a 50 femtosecond pulse with 5 milliwatts on the left side, and you see a very clear contrast. As a comparison, in the middle, you see a 6 milliwatt average power pulse with 160 femtosecond pulse. So the power level is more or less the same, but you see more or less no contrast. And this is exactly the benefit from having shorter pulses. On the right side, it's just a scaled up version of the picture in the middle, and you see that the contrast is even low, even if you use some kind of computer to scale it up. So if you want to do multiphoton microscopy, the question is, what do you need for a laser? What are the requirements for the laser? As we have seen, you want to have a laser with a very low pulse duration. Finally, you also want to have clean pulses. In the end, it's all about peak power. So if you have no background, which in the end would simply heat up a probe because it's a longer illumination time, this can give you, or the high peak power gives you the opportunity also to do long-term imaging of living cells because you can use it with very low average power. You want to have a good beam profile of the laser because you can have a smaller focus. And finally, as we're talking about femtosecond pulses, you need to have a dispersion compensation unit. Because you can simply imagine that the broader or the shorter the pulse, the broader is the optical spectrum. It's correlated, or it's calculated by the Fourier transformation. So you see that the shorter the pulse, the broader the spectrum, so the more dispersion effects play a role. And to make use of very short pulses in microscopy, you can use a so-called dispersion compensation module. Thanks to Torlops for these nice pictures to illustrate what happens. If you just have a short pulse and you send the pulse through the microscope, you see that you get a so-called optical chirp, which simply means that due to the dispersion of the material, the red part is propagating faster than the blue one, so you simply stretch the pulse in time. If you want to have a very short pulse at your sample, you can use the dispersion compensator, which in the end produces a pulse which is also stretched or chirped, and it means that the blue part is propagating faster than the red one. Then you pass through the optical microscope, the pulse sees all the dispersion, and the dispersion effect gets cancelled, and you get a very short pulse at your sample. This is a very special feature you need to have for really short pulse duration, because there, as I said, the dispersion plays a major role. Finally, if you want to integrate a laser in some kind of setup, you need to have a compact version, and you also want to have no water cooling. You want to have a passive cool system. And I will show you now what could be a solution. We developed some kind of femtosecond lasers providing very short pulse durations in the range of sub 30 femtoseconds, which corresponds to a very broadband optical spectrum covering more or less from 1 micron to 1140 nanometers. The laser can deliver up to 3 watts of average power at a repetition rate of 30 megahertz, and it's a very compact system. It's completely passively cooled. We have some separate electronics with it. It's completely remote controllable, and it's always stabilized. It's always working at the optimum point. And as I said, there's a dispersion compensation module which can compensate a lot of dispersion. Finally, the topic of the talk was to talk about 2 and 3 photon imaging at the same time. And the question is why you can do it. If you see the picture here, you see dotted in blue a spectrum which corresponds to a 150 femtosecond laser. And if you want to do a 3 photon process, you can go to the shorter wavelengths, and you see here the third harmonic of the spectrum. What you can also see in black is the typical transmission curve of an optical microscope. And you see that with this laser at 1030 nanometers, frequency tripled, you end up in the UV range. So the light is simply not transmitted in a normal objective or in a normal microscope objective. For sure, it depends a bit on the characteristic of the objectives, but typically there's no transmission. If you now make use of a very broadband pulse, you see that the spectrum goes up to 1140 nanometers, and you do frequency tripling, you see that there's a significant part which can be transmitted by the optical microscope. And this gives you the opportunity to do also 3 photon imaging with, let's say, with a laser at 1100 nanometers, which at the same time you can use for 2 photon imaging. And due to the very broadband spectrum, this gives you the opportunity. I just want to mention, if you just use a 100 femtosecond pulse, it's simply not possible to do 3 photon microscopy at 1100 or 1030 nanometers, which is a common wavelength for femtosecond lasers. And with this, I want to hand over to Laura to talk about the applications where you can directly see how it works to do 2 and 3 photon imaging at the same time.
Thank you, Oliver, for the very simple explanation of the fundamentals of nonlinear microscopy. So I will now take it over and explain you a bit about multiphoton microscopy applications. And I will start with explaining what you can actually see with those 2 photon and 3 photon processes. So first, third harmonic generation. This is an optical interface sensitive technique, meaning that you can see all the boundaries in a tissue. So for example, here you see an example of a cell where you see the boundary of the cell, but also you see the boundary of the cell nuclei. So you see those cell membranes. And at the right side, you see an example of fat cells. So fat cells are homogeneous, and you see only the contours of those cells. Then we have second harmonic generation. This is generated by non-centrometric structures, meaning that in tissue you can mainly see collagen. So for example, here you see collagen fibers in the skin, and here you see, for example, collagen fibers in the wall of a blood vessel. And then we have 2 photon and 3 photon excited autofluorescence. So if we don't use any labels, but just look at the autofluorescence of the tissue, we can see the signal coming from endogenous fluorophores. So for example, here you see elastin fibers, but you also see the cytoplasm of cells, similar as here, and you can also see the inside of fat cells. So you see that those 4 different signals give you actually complementary information. And as Oliver was explaining, by using a femtosecond laser, we can detect those signals simultaneously. And then we can combine those signals into one image. So you see very nicely how the elastin and collagen and the cells are displayed at the same time. But why should we do this? So what is the motivation behind it? Well, there's actually a clinical need for rapid on-site feedback. So imagine that there's a diagnostic procedure. So for example, the surgeon is taking some biopsies, for example, from the lung, or some surgical resections, and this needs a diagnosis. Then those tissues are sent to the pathology department, where they are fixated, embedded, sliced, and then stained. And then the pathologist can look to the sample with a standard microscope. And this diagnosis is then based on histological information. However, processing is needed, so this whole procedure takes more than 24 hours. So if it turns out that the samples were not taken from the right location, so no diagnosis can be made, then the patient needs to come back for a second procedure. So there's need for a rapid on-site feedback methods, and there are two methods currently that exist: ROSE and frozen section analysis. ROSE is a method where they look actually at cellular samples. It is very fast. It provides feedback within 5 minutes, so that's excellent. You can do this on-site. However, it only provides you cytological information, so not the histological information, and that limits the pathologist to make diagnosis. The other technique that is currently present is frozen section analysis. Here you can actually see the histological information because they quickly freeze the sample and then they stain it. But this feedback takes you around half an hour, so the surgeon then has to wait for half an hour before it can proceed his procedure. So now we have a technique that can actually provide feedback within 5 minutes, can be done on-site, and provide you histological information. And this is what we call higher harmonic generation microscopy. So for this we need a microscope that can provide this histological information and is transportable so that we can actually move it to the operation room. So Flash Pathology developed such a device where we inserted a femtosecond laser. And as I said, there's no need for any labeling or dyes, so everything is processing free. This microscope provides images with a subcellular resolution of 0.4 micrometers lateral resolution and 3 micrometers axial resolution. You can image in 2D, but you can also image into the depth, so you can make 3D images. And we're using a very low power of only 5 milliwatts on the tissue, which means that the tissue remains intact. And that's important if you want to do further analysis on it. So here I can show you an example of how we do mosaic imaging. So how you can make a bigger 2D overview of the image. So you make those images and you stitch them together. We can also do 3D imaging. So here you can see how we go into the depth of a lung alveolus. And then you can also make a 3D image. So you really see how the structures, how the elastin and the collagen are connected to each other. So what can we see more? I have here some more examples. So for example, in the skin, you see beautifully the different cell layers. And then you go into the dermis where you have much more collagen. And I show here the correspondence with the histology. And you see that they show similar features. Here's an example of brain tissue where in light green, so with third harmonic, you see the axons and you also see some cellular features. Then here you see the striped muscles. And this is an example of a gland where you beautifully see the different gland cells also surrounded by collagen. And also here a good comparison with the standard histology stainings. Also, you can, with this technique, differentiate different immune cells. So for example, here you see lymphocytes, which are smaller cells. Then here you see neutrophils and eosinophils, which have in their cells sort of lobules. So you see these lobular structures. This is also can be seen on the standard histology, similar in eosinophils. And the macrophages are these big cells with a smaller cell nucleus. But to come back to the clinical need, of course, it's important that we can make a diagnosis. So now I will show you an example of cancer detection. At the left side, you see a normal bronchus biopsy. So in the middle, you see a lot of connective tissue shown by second harmonic generation in red. And in the outer edges, you see in green the cellular structures. So this is how a normal bronchus would look like. And then if you look at the right side, you see that this architecture is completely gone. And the whole biopsy is filled with green, because in green, we saw all the contours. So these are a lot of cells that you're seeing. And if I zoom in, you can actually see that better. So at the left side, if I'm zooming in on the cellular area, you see that all the cell nuclei, which you see in black, are very regular in shape and size and are quite small. While at the right side, you see, for example, here, a cell that is quite bigger and doesn't have so much cytoplasm anymore. also you do see a cell nucleus inside. And those are features that the pathologist uses to diagnose the tissue. And in this case, this was a feature for adenoscarcinoma. Here you can see another example, also of lung tissue, actually from the pleura, so the outside of the lung. At the left side, you see how we can make quickly an overview image of the whole biopsy. This image is made within 3 minutes. And at the right side, you see a zoomed in image where you can clearly see that the cells are very different in shape, in size and shape. They sometimes have even 2 cell nucleus. They have the cell nucleoli inside again. So this is again shows you clear the features of cancer, which was in this case an epithelioid mesothelioma. And besides the lung examples that I showed, there are also other applications where our collaborators from the VU mainly showed how our microscope can be used. So for example, for parathyroid tissue, for glioma, so brain cancer, for kidney biopsies, and some others. And our collaborators also have published this in quite some papers, and I like to highlight 2 of them. So one of them is about the lung biopsies. Here were 109 biopsies imaged of 47 patients. And it was shown that from the moment that you take the biopsy till the first overview image of the biopsy, it took only 6 minutes. So this is really fast. And those images that then were generated, the image quality was here sufficient within 97%. And then the pathologist also made a diagnosis based on those images and also based on the standard histology images, and those we compared. And then you saw that the diagnostic accuracy was 87%. Another example is a study of Schaap et al., where they made images of parathyroid tissue samples. These were 32 samples of 18 patients, and here they showed also that the turnaround time was 5 minutes. And they could detect parathyroid with a high sensitivity and high specificity of 85 and 83.3%. So these are very promising results, and you should imagine that those are the first results with the first prototype, so this can only be improved. And also the time can be improved, so by automating, for example, certain steps of the process. And next to the cancer detection and the cancer application that I told you, you can also use the microscope for some other future applications. So for example, do some research on the tumor microenvironment. So for example, you can do also time-lapse. You can image cells within time, how they're moving, so you can study the cell dynamics. And this you, for example, can also use for the drug development. So how is the drug perceived by the tissue, and how is the tissue reacting on it? And the images are also all digital, which is an advantage because then you can send the images easily to the pathologist. So the pathologist doesn't have to come into the surgery room, or you can even send it to pathologists around the world. But another advantage is that you can also do AI on it. So you can do some automatic image analysis and maybe even in the future provide some automatic diagnosis on it. And this all is possible because we integrated the femtosecond laser into a transportable microscope. So I'm also curious if you can think of some other applications.